My goal in this is ambitious. I would like all of you to never cross a parking lot in the same way after this presentation. With that in mind, that's the goal. What do you see in this picture? Most people might say, I see a little girl having fun, chalk art on pavement, that's a great thing. After 20 years of working on this project, what I see is a potential exposure event. I see a little girl with her hand touching the pavement. You can actually get in the products we're talking about, they actually can absorb through the skin. If we looked at that little girl's hand under a black light, we would see it's stained from the chemicals in the product. I reached out to a chalk manufacturer who was having a contest, said, hey, kids, go out there and experience the pavement. And I said, could you just warn the kids that have your parents figure out what's there so they don't have an exposure event? Never heard back. No interest in having a dialogue about that. One toxicologist called exposure with a child on a pavement like this a significant exposure event. So all that is happening in this picture. I've seen a lot of challenges. I appreciate Bill's presentation about cooperation from industry. In this industry, much of the industry has been reluctant to change and fought every step of the way. In this process, what can happen when a large group of people collaborate and work toward a common goal? In 20 years, I've focused on a particular toxic paving product. Sounds kind of crazy, but let's talk some more about it. So here's what I'm going to cover: how pavement maintenance can affect your indoor air quality, recognizing the unrecognized pollutant source. Most of the work I've worked on, no one's done this before. It's all brand new. I want to recognize the collective events, what was successful, and is it a model or just a mistake or an anomaly? Oh, and also, that's the last commercially available toxic pavement sealant in North America. It went off the market earlier this year. So celebrations. What are we talking about? Sometimes it's sprayed on, like the guy on the left there has a wand and he's just spraying this toxic product out there. This is a colleague of mine. When he scooped up, this is what it looks like. Seemingly harmless black stuff. But if you come across that, don't do that. That represents an exposure event. Here's a summary of the research. There's all these different vectors, whether it's washing off, volatilizing, wearing off, tracked into houses. As much as 60 different independent studies have been done in Canada, the United States, and Europe on this topic. A few years ago, to honor my colleagues at the USGS who did some of the early work with the city of Austin, I put this together. This is online, all hot linked to 19 different major outcomes when it comes to the environment, human health, sediment, and then worker safety. We did all that, done all that in these 20 years. Much of this early going was discovery and understanding. Since we've finished much of that discovery phase, we've moved into a sort of a ban stage or implementation. This, I want to focus on indoor because most of you folks are building people. If you were aquatic biologists, we could talk about frogs and salamanders and things. Here's a dust study. USGS was the primary author. These units, milligrams per kilogram, just keep in mind 23 is a probable effects concentration. Your typical coal tar sealant about over 4,800 and just no coal tar is 9. But we also see differences in the house. The house changes. In a parking lot, we have 5 here and 129 there. There's no set standard for indoor air quality, but let me show you something. This long-term health effects of the exposure in the dust for a child and the dirt near the parking lot is essentially 1 in 10,000, which is 38 times increased cancer risk versus not living on a coal tar sealed surface. Massive lifetime cancer risk. 1 in 10,000 living with a smoker. This came out a couple of years ago, and as a co-author on that paper, I get notified when someone is quoting your paper. These Chinese researchers were looking to say, hey, we've got pretty terrible outdoor air quality and indoor air quality, but guess what? Chinese indoor dust is less than American They were looking at Austin, Texas, where we did the study. So a China industrial city in China with really terrible air has better indoor dust quality than what would be on a coal tar sealed parking lot in Austin. The other thing I'm always trying to do is put this in context. Long-term, multi-year, maybe it's up to 15-year study right now, ongoing, following children exposed to PAHs, that's chemical of concern, polycyclic aromatic hydrocarbons. Looking at that versus the seal coat, we have about 300,000 coming off a parking lot as it cures and dries. What affects pregnant women is an aging parking lot as it continues to waft off chemicals. That chemical exposure is 138. So 36 is enough that you can have a statistically significant reduction in your IQ, your behavior, your birth weight, head size, etc. Yet we continue to do this around the United States. So I've done a lot of work on this. Let's look at the good news and what you see and what you don't see. No longer retail available in North America. 30 million pounds of toxins reduced every year currently. More than 100 bans across the United States. Statewide bans in these 6 states. It affects close to 100 million people. Supported by American Medical Association. A nationwide ban started in Canada. Here's some of the stuff you don't see. We had dozens of staff members working at the City of Austin and USGS in 2003. More than 60 peer-reviewed papers, 400 articles, 20,000 emails, dozens of nonprofits, dozens of presentations, 1,000 politicians and staff, 400 gigabytes of data, 3,000 posts on X, 75 videos, and 3 inventions. That's what's taken to get that. So that's my wife and my granddaughter there, honoring some folks who were instrumental. Tom Ennis on the right, he was first to figure all that out with the City of Austin. Congressman Lloyd Doggett from Texas helped push the EPA to do a study on this. Some politicians may do lip service, but he did what he could to move that along. These are the 2 primary USGS researchers. There were others, Barb Muller and Pete Van Meter. I highlight these 2 interesting positive examples of people who've been affected. I got a call maybe 10 years ago. We get calls from upset parents. Hey, I just put something down on my driveway and then I saw your website. Tell me about that. She had 4 young kids. She put toxic stuff on her driveway. We went over some options. Next thing I know, I got a call from her and she says, hey, I'm running for city council. And the first thing I'm going to do is ban this stuff. The first ban in Pennsylvania is by Mandy Steele. She calls me a couple of years later, says, hey, I'm running for state rep. And she's working on a ban statewide in Pennsylvania. These Maryland school kids, 5th graders, did a study of this issue and presented to Howard County, Maryland, passed a ban. Then they went ahead and they testified before the state several times until a ban was ultimately passed in the state of Maryland. So 5th graders, by the time they were done, were high schoolers. They learned science and civics all at the same time. So this is what National Asphalt Paving Association says, no use for this stuff. So is it a model or an anomaly? I'll let you guys decide. The company I work for now is SEH. They hired me to help bolster sustainability with them. And I told them, hey, I'm doing this crazy paving stuff on the side. Are you guys okay with it? And they said, sure. If you're curious, you go look at that blog post. Are you paying too much for your carcinogens? Sometimes you do. The cheapest way to get carcinogens at your home is to seal your driveway with toxic stuff.